Assalamualaikum ji, this is Dr. Nukumul Rahim, and today we will do the practice part 4. So let's begin. H reflex is electrical equivalent of deep tendon reflex, afferent path of reflex arc, superficial reflex, afferent path of reflex. Option A is correct, deep tendon reflex. The muscle that is responsible for the resisting or opposing action is called the A. agonist or prime, B. synergist, C. antagonist, D. insertion. Option D is correct, insertion. You have received a physician order to discharge an inpatient that has been under your care a total knee replacement. Which of the following personnel would you contact first to start planning discharge from the hospital to whom? Select the most appropriate answer. A. The physician, B. social worker, C. patient's family, D. home health agency. Option B is correct, social worker. Bursa may be found in most of the locations within the body. Which of the following anatomical areas would the bursa most likely not to be found? A. subcutaneous, B. intramuscular, C. subcutaneous, D. subfacial. Option B is correct, intramuscular. Type of orthosis used to provide contralateral hip extension with ipsilateral hip flexion. A. reciprocating gait orthosis, B. swivel orthosis, C. pelvic harness, D. none. A. reciprocating gait orthosis is the right answer. Option A is correct. Root of spine of scapula corresponds to A. T2, B. T3, C. T5, D. T7. Option B is correct, T3. Brain death may be due to A. irreversible loss of capacity for consciousness, B. loss of capacity to breathe, C. brainstem death, D. death of cortex. Option C is correct, brainstem death. Patient status post-medical meniscus repair is referred to physical therapy. Which of the following would be the responsibility of the physician post-operatively? A. Specify the parameter for superficial modality applications. B. Specify the frequency and duration of range of motion exercises. C. Determine weight-bearing status. D. Select an appropriate resistive exercise program. Option C is correct. Determine weight-bearing status. RH factor is positive in A. 15% people, B. 26% people, C. 28% people, D. 85% people. Option D is correct, 85% people. 1 liter of oxygen expended is equivalent to how much calories? A. 10 kilocalories, B. 10 calories, C. 5 calories, D. 5 kilocalories. Option D is correct, 5 kilocalories. What is the spinal nerve contribution that composes the brachial plexus? Option B is correct, C5 to C8, D1. A patient's status post-large rotator cuff repair surgery is referred to physical therapy. Which of the following motions would you initially expect to be the most restricted? Option D is correct, lateral rotation. Rotation is mostly expected to be the most restricted motion. Okay, so the next MCQs is a physical therapist performs an initial evaluation on a patient at a skilled nursing facility. The patient current diagnosis is exhibition of COPD. Her goal is to return to her home where she lives by herself. Currently, she requires minimum assistance for bed mobility, moderate assistance to transfer, and standby assistance for gait with walker. What treatment intervention can specifically address her physical impairments? Option B is correct, functional training. In the body, the absorption of ultrasound is maximum in A. blood, B. nerve, C. skin, D. bone. Option D is correct, bone. In the body, the absorption of ultrasound is maximum in bone. Okay. Physiological neonatal jaundice is caused due to A. hypoxia, B. splenomegaly, C. hepatic immaturity, D. anemia. Option C is correct, hepatic immaturity. The posterior columns of the spinal cord cross in the brainstem. What information do these tracts convey? A. pain and temperature, B. proprioception and vibration, C. motor impulses, D. orientation of the head towards the sound. Option B is correct, proprioception and vibration. आज हमारा प्रैक्टिस टेस्ट 1 पार्ट 4 पे ये जो टॉपिक है कंप्लीट हो गया है। इंशाल्लाह जो नेक्स्ट वीडियो है उसमें मैं आपसे साथ डिफरेंट और न्यू MCQ शेयर करूँगी जो प्रोमेट्रिक में बहुत ज़्यादा रिपीटेडली आते हैं, और कुछ कंसेप्चुअल होंगे, कुछ शॉर्ट MCQs होंगे, कुछ लॉन्ग होंगे। सो इंशाल्लाह नेक्स्ट वीडियो में मैं आपके साथ वो शेयर करूँगी। सो स्टे कनेक्टेड टिल देन, एंड इफ़ यू लाइक दिस वीडियो देन डोंट फॉरगेट टू लाइक, कमेंट एंड सब्सक्राइब। सो अब हम सेक्शन 10 से स्टार्ट करेंगे नेक्स्ट वीडियो में। सो स्टे कनेक्टेड टिल देन।